Hello everyone, I'm Name, and I'm a medical professional. Costochondritis and Tietze syndrome, two of the most typical causes of chest pain, will be compared in today's video. Both of these illnesses cause chest pain, but there are some significant variations between them. So pay attention, and by the time this video is up, you'll know how these two disorders differ from one another, which will help you better comprehend your symptoms. Inflammation of the cartilage that joins the sternum, or breastbone, to the ribs, is referred to as costochondritis. It frequently happens when the muscles or ligaments surrounding the chest area get stretched or overworked, which can cause swelling and discomfort there. Sharp, localized chest discomfort on either side of the sternum, trouble breathing deeply, tenderness when pressing on the affected area, and a grinding sensation when you move are all signs of costochondritis. Although physical activity or trauma are the usual causes of costochondritis, other underlying medical problems like arthritis, lupus, or respiratory infections can also contribute to its development. Tietze syndrome is an uncommon condition that causes inflammation in the upper chest rib cartilage. While it shares many characteristics with costochondritis, its main symptom is rib and cartilage enlargement in the chest region, which can hurt and be painful there. Other signs and symptoms may include discomfort when inhaling deeply, chest pain, sporadic swelling on the afflicted side, pain when lightly touching the affected area, and popping or clicking when you move. Tietze syndrome, in contrast to costochondritis, is typically accompanied by more severe symptoms and is not typically brought on by physical exertion or trauma. Even after therapy, it may return. Tietze syndrome versus costochondritis as a diagnosis. Since Tietze syndrome and costochondritis have similar symptoms, it can be challenging to distinguish between the two. A doctor will start by inquiring about the patient's medical history and performing a physical examination to make an accurate diagnosis. To rule out any other conditions, the doctor could also request additional examinations such as chest CT scans or X-rays. These tests' outcomes can be used to establish whether the patient has costochondritis or Tietze syndrome. Treatment of Tietze syndrome versus costochondritis. Both costochondritis and Tietze syndrome are typically treated with rest, ice, and painkillers like ibuprofen or acetaminophen to lessen inflammation and pain. The muscles around the rib cage and chest may occasionally also require physical therapy or exercises, which doctors may also recommend in specific circumstances. Surgery can be necessary in more severe situations. Tietze syndrome is rarely treated with surgery because the ailment frequently gets better on its own without the need for treatment. However, in severe situations or when the problem is brought on by an underlying medical condition, costochondritis may require surgery. Conclusion. I hope this video was helpful to clarify the distinctions between Tietze syndrome and costochondritis for you. As usual, it's crucial to keep in mind that chest pain can have a variety of causes, so if you're feeling any kind of chest discomfort, you should see a doctor. This can assist you in receiving the appropriate diagnosis and care for your disease. I appreciate you watching, and I'll see you later.